Did you know that hair loss can happen at any age, but there are new treatments, new technologies that are out there, and they're showing promising results. Joining us this morning is New York hair restoration expert, Dr. Michael Wolfeld. Nice to have you back on Good Day New York.
Thank you for having me.
So since the last time you were here, which was probably about a year ago.
That's right.
What new stuff do we have to like grow hair back?
Yeah, so there's a new laser. It was just FDA cleared last year in 2024. It is an in-office treatment. What it does is that it helps to, it's actually a fractionated, non-ablative laser. What that means is that it doesn't damage the skin, but it heats up the tissues under the skin, and that helps to release growth factors, and that can help to give a fuller appearance of your hair.
So is that for somebody who maybe is losing hair because of stress and not somebody who is genetically inclined to lose hair?
Yeah, not really for stress, because stress may lead to some shedding hair. So it's not for that. It's for people who have genetic hair loss, have some thinning hair, so it can give her a fuller appearance of thinning hair. I see you have some products here. Yes.
Should we talk about some of the products too? If you don't want to do the Fraxel, is it called Fraxel?
It's called Folix.
Folix.
Yes.
And how many times do you have to do that before you see results?
So usually you do it every 4 weeks for 4 to 6 treatments, and then it's 2 to 3 times a year.
And it's expensive?
It can be. It's about $800 to $1,000 per treatment, depending on where you go and the clinic.
Got it. And this is what before and afters we're looking at?
Yep.
Is that a before or after? Oh, there's the after.
Yeah.
There's the after.
So
that's big.
That's after 3 treatments.
Wow. Okay.
Yeah.
So it does work. Who doesn't it work for?
So someone who has a bald scalp, it's not going to regrow hair on a bald scalp. So someone who's lost hair significantly and they just don't have any hair in that area, it's not going to work there. But someone who has a lot of inflammation or has a history of skin cancer in the scalp should check with their doctor first before using it. But for someone with early thinning hair, it can be helpful.
Got it. Okay, I see a lot of products here. Let's talk about them.
Yes. So these are some botanical products. So in treating hair loss, there's medicated treatments and non-medicated treatments. The medicated treatments such as finasteride, which is approved for men, FDA approved for men, and minoxidil, which is approved for men and women. Those are helpful. These are some non-medicated, which I always recommend if you want to use it in conjunction with a medicated treatment. But if you really don't want to use a medicated treatment, these are can be helpful. So you have saw palmetto.
What's that?
So that is a root botanical product.
Okay.
And that can help to thicken and strengthen your hair. You also have rosemary oil.
So I've heard a lot about rosemary oil. In fact, I think I bought this. It's like $16. I think I got it online. And supposedly it's supposed to help grow hair.
Yeah.
Because I feel like with all the blow drying, that my hair is, I know I have a lot of hair, but I feel like I need to preserve whatever I have.
That's right. So rosemary, and then there's caffeine, there's red clover extract as well. So these, and pumpkin seed oil, these can help to preserve your hair, may help to thicken your hair as well.
Okay. And then what do you have up here?
So yeah, this is the caffeine. This is the pumpkin seed oil. And we have Botox, a bottle of Botox here. So the reason we have this here is that there's a treatment that is trending that's off-label, but people injecting Botox into their scalp called Blowtox to help to reduce sweating in their scalp. So if they are in a hot environment, if they work out a lot, if they go for blowouts, it helps to preserve your hairstyle, your blowouts, by reducing sweating in your scalp.
Botox in your head. How many injections do you need?
So you need a lot. I mean, you need, could be up to 100 small injections in your scalp. So
whoa.
Yeah, it could be a lot, but it lasts 6 to 9 months, and it could be helpful.
Okay, can we talk about the eyebrows? Because this morning, all the women on the staff were talking about we need to figure out how to regrow our eyebrows because we all overplucked when we were kids.
That's right. So I see a lot of people who have overplucked, overtweezed, and even as they age, their eyebrows thin out, and there are treatments available. One of a really good treatment that I see a lot of patients for in my office are eyebrow transplants. So we actually take hair from the back of the head, and we transplant them to the eyebrows exactly as the hair naturally grows, same angle, direction, blends in, looks completely natural.
Okay, so what are we looking at here?
So this is a before picture of someone who had tweezed their eyebrows.
Right.
And you can see the eyebrows are deficient there. It's grown in after the transplant, so it looks fuller. and broader, and people can decide what, how broad they would want, the shape that they would want, but it looks really natural.
Then can you trim them yourself, or do you have to be careful about tweezing them?
No, well, yeah, you trim them as often as you need to keep them, intact and to make it look nice and aesthetic.
Wow. All right, doctor, where can people find you if they're interested in knowing more?
So my website is wolfeldhair.com, and we're on Instagram at Dr. Wolfeld.
Nice to see you
All right,
again.
thanks a lot.
Thank you for all the new information.